On part 2 of this 3-part episode, we continue with the Mental Health Awareness panel discussion held by the Atlanta Suburban Alumni Chapter of Delta Sigma Theta Sorority. Licensed professionals and community partners led a panel discussion covering the topics of depression, anxiety, suicide, and more. The event took place May 11, 2019 at the Welcome All Recreation Center in South Fulton, Georgia.
I want to talk a little bit about depression. How would one know that they are depressed or they're experiencing symptoms of depression?
Well, I think one of the first things is if you're thinking about it, definitely you don't have to go and be by yourself and Google it, because I know sometimes that's admittedly the first thing we often do when we're curious about some of the things that we're experiencing. But even the fact, if you're even thinking about it, I would say, just go and talk to somebody, because you don't necessarily need to meet a criteria to help what's going on with you. So if you're having some of the symptoms that one would experience when they have depression would be, the insomnia, sleeplessness, some irritability, some mood changes, a lack of interest or a lack of motivation, a lack of pleasure in doing things that you once found were pleasurable. And of course, the sadness, fatigue, and it could look different with adults versus children. With children, you might definitely see that they will have some changes with their academic performance. You'll notice that there'll be some interpersonal and social issues. I think both adults and children will do some form of isolation and get very comfortable with being isolated in that sense. But anything that's very out of the norm, what's out of the norm for you. And then others might notice some things as well. So I hope that kind of answered the question in terms of what that would look like. But I think, you don't have to guess, and that's why help is out there for you. So even if you don't meet the criteria, there are still ways of, as Paige says, that you can address your mental health, just to kind of keep yourself doing the things that you normally would do on a day-to-day basis.
Well, I was also going to add to that. I think that's so helpful, because what you said, you don't have to meet the criteria. And if you're sensing that you're not yourself, get ahead of it. Go ahead and go talk to some. In our community, we were often taught what happens in my house. And so that mentality carries on, and we live on what I call Isolation Island. And you have to get off of Isolation Island. Now, I'm not saying, hear me, I'm not saying go put it all on Facebook. I'm not saying go say, y'all, I'm feeling bad. Find somebody that can help you navigate. And one of the things I also wanted to mention is this can be so many layers to it, and that's why you don't want to do it by yourself, because there's a certain such thing called situational depression, and then there's chemical depression. And the situational depression is, I have a situation that has my mood down. My man broke up with me. I broke up with my man. I lost my job. My mother is sick. And that situation has triggered your mood, and your mood is going down. But how you know it's situational is when that situation improves and your mood improves. But if you're finding that regardless of the situation that's going on, your mood is staying low, then that's very important to pay attention to. And then the other thing is, again, a lot of, if I have a black spot on my forehead right now, I won't know it until somebody says, girl, there's something on your forehead, or Robin, go look in the mirror. A lot of times you don't know how you're showing up, and the people around you can tell you, what's going on? Something's not right. You're not yourself. So make sure that you're paying attention to those clues as well.
And I'd also like to add that it is important to talk to your physician as well, because sometimes people have certain medical problems that can mimic a lot of these different illnesses. For example, the thing that comes to my mind is thyroid. A lot of people suffer from thyroid disease, and that can mimic depression. an underactive thyroid can mimic depression, and sometimes it can mimic thyroid abnormalities can mimic anxiety. People have panic symptoms, and then lo and behold, they may have an overactive thyroid. And then there are different vitamin levels that need to get checked, like B12. And sometimes, depending on the symptoms people have, they may even need a scan of their brain. So it is important to do more than just a Google search, and go and talk to a professional about the symptoms that one is having.
I know I've been living with depression since I was 10, and it has changed over the years. So as a 10-year-old, my depression, I was by myself a lot, but I had a lot of crying spells, and it wasn't just before my math test or before I had to go to school. It was maybe 4 to 5 times a week. I had a lot of anger outbursts, and it was easy to say those are just her being a child, but it was actually my symptoms of depression showing. As I've gotten older, they've changed. I still isolate when I'm not well. I become very irritable. That's my number one symptom. So I'm like, you know what, something's not necessarily right. And another one is not being able to get out of bed in the morning. Sometimes it'll take me about 10 to 15 minutes, and then I have mornings where it could take 30, 45 to an hour, where I can't do it. And just those daily life challenges become almost impossible. That's how I know personally that I'm probably in a state of depression.
Thank you. That was great insight. Nanisha, you mentioned insomnia. Is that a form of mental illness, or if we look at the other end of the spectrum, if I'm someone that likes to sleep all the time, is that an issue that I probably need to go and talk to someone about?
Well, I think the first thing that comes to mind is that insomnia, I wouldn't just assume is associated with a mental health disorder. As Dr. Cox mentioned, that if you are curious about the insomnia or have some concern, I think physicians are great. They're usually the ones that I find that individuals feel the most comfortable with in sharing, some of those symptoms, because it could be related to a physical health condition as well. So I think it does not hurt to get to rule that out, that there could be possibly a physical condition that might be contributing to the insomnia. But insomnia can be related. It can be a symptom of, several different mental health disorders. Like for depression, or I'm trying to think what other disorders might. Anxiety as well. Yeah, PTSD, definitely. Bipolar disorder, postpartum. So it can be related to any of those different things. But like I said, if it's out of the norm, you're sleeping longer or you're sleeping less, if it's not related to a physical condition, usually that insomnia is connected to some sort of stressor that is occurring with you. So definitely, like I said, you can get that checked out with your primary care physician. And then a lot of people may not know too is that your primary care physician, most of them are open to prescribing medications for mental health as well. They can do that. And they will, often refer you to see a psychiatrist, and that's something that I can explain too, that a lot of people don't know about with our different credentials. So psychiatrists are, physicians who are trained, they're doctors, but their specialty is in behavioral and mental health. And they're pretty much the only ones that will prescribe the medication in our mental health field. And then they may have some nurses that they work with that also prescribe the medications. And then we have psychologists that often have PhDs, and they do a lot of evaluations, like very thorough evaluations that might need to be completed. And then you have your master's level counselors, such as myself, an LPC, your LCSWs, who were licensed, to provide counseling in community settings or medical hospitals. And we often engage in short-term and long-term therapy. And you will find some psychiatrists that will some of them will do some therapy as well. But I just wanted to kind of share with y'all the differences about our credentials that might be helpful when you're doing your search.
is the mental health therapy something that is covered by your insurance, Medicaid, Medicare? Can you talk to us about getting the help that we need if we don't have necessarily financial resources to go about doing that?
Yeah.
So yes, mental health issues are covered by insurance, and the most important and valuable resource for lots of communities is the community service boards. Whether you have insurance or not, you're more than welcome to just walk in and talk to somebody. They have psychiatrists, they have social workers, therapists. You can get everything there. And sometimes it might take a little bit longer because a lot of people utilize the community service board, but that is something that is available to you as a community. And it's sometimes insurance is lapse. Again, the community service boards are there to serve the community.
I will also add to, in terms of, let's say if you do have some services that are not covered by your insurance, there are other options out there. You can always check to see if your employer offers an employee assistance program, which is that there might be a set number of sessions that your job has a contract with an outside agency to give you those sessions, and they're not supposed to know or ask anything about why you need it. They just give you a telephone number to call, and you can get some sessions that way. There are also a lot of organizations that offer sliding scale fees. I've worked with agencies where the sliding scale fee is as little as $20 per session. And that's very low in our field, where the average session is $100 to $200, $300 per session. So there are different, avenues out there in terms and resources, because there are some things that are not always covered. I'll say a common one that my clients often run into is couples, counseling. They often find that many individuals do not accept insurance for couples counseling. So that's when those EAP sessions might come in handy, or sliding scale fees might come in handy. So there are a few resources out there. And then there are also some therapists who may not be able to bill your insurance directly, but then they can give you what they call a super bill, and you take, which is kind of like an invoice, and you can send that to your insurance company. And some of the insurance companies will pay a percentage for what they call out-of-network providers. So, if you paid $100 for that session, there may be a contract with that insurance company that they'll, pay about 50% of that or 40% of that for you. So I know it can seem like, how do I figure this out? But if you ask somebody, you ask your insurance company, they'll be able to, point you in the right direction about that.
So at this time, I think this will be a great point to open up the questions in the audience. Okay. So I'm going to do a quick follow-up question before we open up the questions to the audience. I wanted to understand more about, if I am working at a company, how do I keep my mental issue confidential? Does the HIPAA laws protect me from that? If I'm dealing with this issue, how do I protect myself from any sort of discriminatory issues?
I like to say that a therapist, a psychologist, a psychiatrist, we pay our mortgage by confidentiality. So that's the beauty of going to a licensed professional, because we are bound by confidentiality. We are not allowed to tell your business outside of what happens in that counseling office. So if you're talking to your girlfriend, your girlfriend might fall out and she might tell her next best friend. If you're talking to your auntie, she's gonna get on the phone and call your mama, right? But in therapy, that's the beauty of it. Now, so your employer does not get access to the full information that happened in the counseling session. The therapist, I know for me, my notes are very high level. because I want to make sure that I'm protecting that confidentiality. If we are dealing with short-term disability, and if we're dealing with insurance in that way, your job is, we're having to send information to the short-term disability office, it's still not talking about, in the session today, she says she can't stand her boss. They're not getting that information, right? We have to tell them she came to see me on the 1st, on the 10th, and on the 17th. Her next appointment is on this date, but you're not getting that personal information.
Thank you so much, Robert, for sharing that. So we just got some questions from the audience, so I'm just going to address these to the panel. And ladies, feel free to pick up these questions as you feel they're appropriate for you. This one says, is there a such thing as a random diagnosis, or are there always warning signs early for mental illnesses? So is there such thing as a random diagnosis, or are there always warning signs early on for mental illness? Does anyone want to take that?
There are warning signs. My very first warning sign, again, I had depression since I was about 10 years old, but when my bipolar disorder started to show, I had extreme insomnia. I probably was getting maybe about 2 to 3 hours of sleep going on about a year prior to me being diagnosed. That was an early warning sign. My coping skills, which was drinking and other drug use, that was an early warning sign. I was very hypersensitive, and just all the symptoms that I actually read about after, those were my warning signs. So I do believe that things start to show, just like our physical body. If you were to have a cold, your throat would maybe hurt at first, and those are your symptoms. So I do believe that early warning signs are true, yes.
Okay. Wait, I wanted to say something to that as well, because, we can paint a pretty picture of therapy being, go to therapy and it's going to be okay. It's not always an easy process, and we want to make sure we keep it real with that. When a client comes to see me, I'm having to listen to the symptoms, and I have to often listen to those symptoms over a period of time, and then that means you have to be coming to me consistently, and then I have to realize you're only telling me from your point of view. I'm not hearing from the point of view of your mother or your boyfriend or the people who are doing life with you. And so often people can come to me, and initially I'm sensing or believing, or I'm saying sensing, but that's sometimes what it is. I'm listening to all the symptoms and I'm thinking, okay, this is the direction we're leaning toward. And then something else happens and I realize, I had a client a couple of years ago that she came to me with the diagnosis of bipolar disorder. By the time she left, or by the time I referred her to the next client after me, or therapist after me, we had recognized that it was schizoaffective disorder, which is schizophrenia with a mood shift. And so she thought she had bipolar for many, many years, and then we realized it was schizoaffective. And so I often say finding a therapist and finding a nurse practitioner or finding a psychiatrist is really about finding that fit. And you got to find the person that fits with you. I'll tell my clients, listen, let's just see if this is going to work with us over the next 3 or 4 sessions, because you might find that my personality is too direct for you and you need somebody that is not as direct as me. And that's okay. That's okay, because it has to be a good match. And so we don't want to paint the picture like you find your therapist and it's all good. And like you said, I love that over time it evolves. And so what you're presenting when you're 17, you're presenting something else when you're 25. And so we have to have some flexibility as we figure out what it is. And I know you can speak to, even with the medication, you're trying to find the right cocktail of medication. And this cocktail might work, and then you realize that we have to shift it to something else.
Yes, and I do appreciate the fact that I appreciate the question, and I totally agree with Paige in that oftentimes people have these kind of prodromal symptoms, and it's not necessarily clear what's going on. And I think sleep is probably one of the most common things that gets affected. And sometimes it's not insomnia, it's sleeping too much, which we call hypersomnia. And then sometimes the person may become withdrawn. And those two things in and of itself are not enough to make a diagnosis. And so then over time, more symptoms start to present themselves. And then also, I just want to mention, I work, or actually my background is in addictions, and so that also is a very important part of the equation. How much does alcohol, for example, play into the picture? Because that makes it even more difficult sometimes to for your therapist or physician or nurse practitioner to figure out what's going on. And then as Robin asked me to talk about medications, as a physician, we have to take into account not only what's being presented or the symptoms that we see, but also other medical conditions a person may have, because not every medicine is for everyone. We take into account their age. For women, we have to take into account, are they pregnant? What other medications is the person taking, including over-the-counter? Just because something is over-the-counter doesn't mean we can take it in excess, or it doesn't mean that it's not going to interact with other medications that are prescribed.
Thank you so much. So we're having a lot of questions that are pouring in, and we have a question from the audience that we're gonna allow her to ask her question, and then I'll go back to the index cards, and we'll keep this engaging discussion going.
Okay, this is just a comment. Good morning, ladies. Thank you so much for being here. I'm a counselor, educator, and supervisor, and I've been LPC for the past 15 years. And your question regarding what happens at work, I wanted to just make a comment about the other side of it. So as an individual who has a mental illness, it's an opportunity for you to be your own advocate. And so when it comes to what happens at work, that really is up to you. And you, meaning you are the guard of your information. If you do not want your boss to know you have a mental illness, that is your right. If you do not want your boss to know that you need time off because you're going to a therapy session, that is your right. Now, if you feel like you need to say something to your boss or your coworkers, that might be a conversation on how to communicate that you have with your therapist. That could be very helpful in how do you communicate your own confidentiality, but provide some information to let your job know that you might need to take a day off here or there, or you may be out for a period of time. So I just want to encourage the audience, you have to be your advocate, and your therapist and your treatment team will be there to support you, but your business is your business. And as the Robin May mentioned, we are obligated to keep your confidentiality, so it's up to you if you share. So just be mindful, you may not want to share your information, and that is completely okay as well. So I will leave it at that and go back to questions.
Thank you so much for sharing your insight on that. We appreciate it. I want to go back to some of these questions, and we're going to try our best to get all of these addressed. This person says, how can you help as a family member? My niece has just came home from the hospital with her parents are scared, and very scared, and her meds cause her to sleep a lot. Did I ask that question correctly? How can you help as a family member? Looks like this is what this person is really asking. If you have if a family member has some sort of mental illness, and what kind of support can that person provide?
In terms of the medications, it is important to let the prescribing practitioner know of any side effects that one is experiencing. Sometimes side effects can be short-lived. It's important as a person who prescribes to let people know up front the side effects that they may experience or should anticipate, because sometimes if we don't bring it up, the person won't even connect it with the medication. But it is important to let the prescriber know, as opposed to stopping the medication or trying to adjust the dose oneself. And so I think another thing that a family can do to be supportive is to really try to educate oneself about the symptoms and the illness. I think that I like what Robin said about trying to have empathy, because we all know what it's like to experience sadness. And the thing, though, that we don't all know is what it's like to experience depression. Sadness is not depression. And I think that, sometimes family members are tempted to say, well, I don't know why you can't snap out of it. I don't know why you can't get over it. I've been through this and I got over it. But in doing so, the person who's saying that they might, they got over it, they may not have had major depressive disorder. They may have had an adjustment disorder. An adjustment disorder may cause sadness, but it usually resolves once whatever that stressor has gone away. And so, again, I think it's important for family to really educate themselves about the particular illness that the family member is experiencing. And also, there's help for that, like NAMI can be a very helpful support system for family members and concerned others. And I know this goes back to an earlier question, but I do want to address it. There's, for people who may need help finding a mental health professional, there's the SAMHSA National Hotline or helpline that can help, and I just want to give you that number. It's 1-800-662-4357. And that can be helpful, and it also will address whether or not the organization takes insurance or sliding scale, et cetera.
So a follow-up to that question that just came in from the audience, can you give them some names of organizations that offer sliding scale options, particularly in Fulton County? Anybody?
Yes, I would say one thing that you can do if you want to find like a private counselor, maybe someone who's just maybe one counselor or two counselors. I know one that a platform that I use is Psychology Today, where you can put in your zip code and it will pull up a list of providers in the area, and you can narrow your search to whether or not they take insurance, or you can also find out if they accept sliding scale fees. You can also you could try the Georgia Crisis and Access line. Now, it will be a very helpful tool if you don't have insurance, because they have a database throughout the whole state of Georgia of organizations, and they can actually connect you and set you up an appointment as well. That's the Georgia Crisis and Access line. It's a 24/7, and there are licensed counselors who take the calls, and that number is 1-800-715-4225.
Thanks for watching. Go to AIBTV.com/donate to support programming like this. Your contributions may be tax deductible.